Hello everyone, my name is Rick McLaughlin and I would like to talk to you about our 2-year postgraduate orthodontic program. It is limited to orthodontic specialists only. The program is held in San Diego, California at our orthodontic office, located in an area called Liberty Station, which was previously the Naval Training Center. Liberty Station is conveniently located near the San Diego Airport and the downtown area of San Diego. We will be holding our 13th session beginning in March of 2018. Here you see our office entrance and reception area. Our teaching facility is in our office down the hallway to the right. We have 30 seats in this facility and 2 large screens. The program consists of 6 courses over the 2 years. Each course consists of 2 parts, a theoretical part and a practical part. Here are the topics of the 6 courses which we will discuss. There's flexibility with the program. If you have a conflict with one of the courses, you're able to make it up in the following session. Course 1 is our treatment mechanics course. It runs from March 2nd to March 6, 2018. This is a 5-day course because of all the material that we need to discuss. Here are the topics for the first session. We go through a historical perspective of our mechanics. We spend quite a bit of time on diagnosis and treatment planning. We then go into the 6 stages of orthodontic treatment, where we describe the mechanics that are involved with each of these stages. We discuss the pre-adjusted orthodontic appliance. We talk about arch form and archwire sequencing and bracket placements. So it's a very busy 5 days. We have 3 textbooks that I've published with John Bennett that deal with this topic, and here they are. This is the 2-year practical program. We deal quite a bit with diagnosis and treatment planning. We work with typodonts and do a number of mechanical procedures. We break into groups and we have observations in the record room, observations in the initial exam room, consultation area, and observations of patients in the clinic. Here we are in the consultation area discussing treatment planning with the patients. We will spend time in here going through these very important aspects of our practices. We have 2 main sponsors for the course, Precedent and Dolphin Imaging. Dolphin will place their program on each laptop of the participants, and we will go through facial planning and we will go through the dental VTO. This deals with the movement of very important segments, including the midlines, the canines, and the molars, and gives us a better look at what we're trying to do with the case. Course 2 is held from June 23rd to June 25th. It's a 3-day program. It is entitled Inner Arch Treatment Mechanics and deals with the subject of Class 2 treatment. We will cover early treatment and regular full banded treatment. We will cover these main options and spend time showing cases to demonstrate what our thinking process is with these options and how we treat the cases. We talk about removable functional appliances. We use the twin block appliance. Here you see a Class 2 case. We take an edge-to-edge bite and construct the appliance. Here you see the occlusal views. And after the appliance is completed, the treatment is completed with the appliance, we then place fixed appliances for about a period of 1 year. And here you see the final result. We also use fixed functional appliances, and we'll talk about Class 2 correctors. We also spend time on the topic of indirect bonding. We will go through each step very carefully from the laboratory to the clinic, and then we will show you a video of the process You'll be able to take this information home, and if you would like to, you can send 2 of your staff members, one who would be doing your bracket placement, helping with bracket placement, and one that would be doing the placement in the clinic. It's very helpful to get the details down. And in the practical session, we do a lot of case reviews. Here are our trays that we use. They're clear trays, and you can see each bracket is placed and retained within the trays. Here you see the trays placed in an upper arch using the NOLA retractor. Course 3 is held October 5th to October 7th, 2018. This is our second part of inner arch treatment mechanics, and we deal with class 3 treatment and asymmetries. We will deal with early treatment of class 3s and regular full banded treatment of class 3s. We'll go through all the different treatment options that we have with class 3 treatment and talk about the rationale for each approach. Here's a class 3 case, and we will talk about the modifications of the appliance that we need when we're using class 3 elastics to correct these cases. We use the bouldered plates on more difficult cases. We start these around the age of 12 to 13 as needed. They were developed by Dr. Hugo de Klerk, and they're very excellent for advancing the maxilla. Here you see the plates in position prior to fixed appliances. And here you see the brackets being placed, and the plates continue to be used during this time. Here you see the final result, and we leave the plates in for some time so that we can use them for some class 3 mechanics if there is a relapse of the case. So we can take them out later, but we try to leave them in for a good period of time. Here are the final occlusal views, and you can see the plates in position. We cover the topic of asymmetries, and we break these down into 3 parts: dentoalveolar asymmetries, functional articular asymmetries, and structural skeletal asymmetries, and we go through each of these types of cases. The practical part of the course deals with more diagnosis and treatment planning, case reviews, and a topic called practice pearls, where we go through all the equipment in the office that we use that is of quite interest to everyone. Course 4 is held February 9th to 11th, 2019. And it's entitled Management of the Dentition. In this course, we go through various treatment options for each tooth, various things that tend to occur in our practices with malposed teeth. We deal with impacted central incisors. We deal with missing laterals, peg-shaped laterals. We deal with impacted cuspids, and so on. So we cover each tooth in the dentition, and it's a very enjoyable course, and most people have a good time with this course. We have a textbook to back it up, and we'll be giving you this textbook when you come to the course. Here's a couple of cases. Here's one with an early eruption of a lateral incisor. This is never a real good sign. And here we take a Panorex, and we can see a number of teeth in there, but it's very confusing what is actually going on. So I'll take a 3D picture of the case, and you can here now see the supernumerary teeth behind the central incisors, and we obviously need to get those out along with a number of deciduous teeth. So here are the teeth that we had removed, and then we wait for a period of time for some eruption, and then later here we are bringing down the impacted central incisors and finishing up the case. Here's another case with oddly positioned front teeth, and you know that something is not going well in this situation. So here's the Panorex. You can see the teeth look very strange here. So we take a 3D picture, and we noted that the roots of the central incisors were at a 90-degree angle to the crowns. We did not find a successful way to manage this, and so we took those 2 teeth out. We put the canine in the left central position and the right lateral in the right central position. We took out lower first bicuspids because of the flaring of the lower teeth, and we ended up with this occlusion. We did some bonding and adjustment of the teeth in the front and had a very nice result. Very difficult case. The practical portion of course 4, we do more diagnosis and treatment planning and more case reviews. This is a very enjoyable part of these courses. A lot of discussion about cases during these sessions. And we also go through finances. We use the Zelke system in the practice for our collections, and it's a very excellent system, and we go through that in great detail as to how we manage that important part of our practices. Course 5 is run from June 8th to June 10th, 2019. It is entitled The Occlusion, the TMJ, and the Orthodontic Treatment. We go through various aspects of TMJ treatment. We do a historical review of the material. We talk about diagnosis and treatment planning of these difficult cases. We talk about our techniques for splint therapy and when they're indicated. And then we go through our case treatment with post-splint management. We have a classification of these cases in the vertical, horizontal, and lateral dimensions, and we go through cases in each of these categories. So it's helpful in keeping ourselves out of trouble with this difficult TMJ problem. We look at pictures of the joints with CT scans, and we talk about a medication protocol that we use in treating this. This medication protocol was developed by Steve Milam and utilized by Bill Arnett and Mike Gunson in Santa Barbara, and we'll go through the details of this very helpful adjunct to our treatment. Here you see the medications that we tend to use. We also talk about articulators, how we use these to make the splints, and how we manage splint therapy. In the practical session, we talk a lot about diagnosis and treatment plan again, and our case reviews directed at management of TMJ cases. Here's my partner, Paul Uppetham. We go through each of our cases very carefully and talk about various options for treatment, and it's good to have the two of us together to go through these cases very carefully in this very important part of treatment diagnosis and treatment planning. Course 6, our last course, is held December 7th to 9th, 2019. Here we talk about surgical orthodontics, go through a number of cases, virtually all the categories of surgical treatment, and we spend some time reviewing the material that we've covered over the previous 2 years. So it's a very helpful course to kind of wind things up and ask your final questions. We provide a textbook that I published with Bill Arnett that deals with this topic in some detail. We will go through the 7 stages of treatment planning, Bill Arnett's 7 stages, and this is very helpful in setting up surgical cases. Here's one of the patients that Bill and I treated some years ago. You can see the nice result with this patient.